Hello all, I'm Dr. Ravneet Kaur Gill, an assistant professor in the Department of Anaesthesia at AIIMS Mohali. I welcome you all to the second session of the BCBR course, which is Formulating the Research Question. In this session, we will learn about how to define the research question, how to formulate one's own question, and how to elaborate the research hypotheses. Every research has to go through a life cycle. First and foremost, there is an uncertainty about the data. So the researcher identify what data needs are there in the literature. This helps the researcher to spell out the research question and formulate the study objectives. After that, the researcher plans the analysis and prepare the data collection tools. Then they eventually collect the data, analyze it, and draw conclusions from it. Then this is then converted into recommendation, and the stakeholders are informed regarding the same. There is a research problem which the researcher wants to do. The researcher asks, what am I going to study, why, and how? It sets the frame of reference for the study. That research problem is then converted into a research question. What the researcher wants to know is there is some data in the population that the investigator wants to measure. What will be the design of the study? What outcomes that the researcher wants to measure? It all begins with an idea, and that idea is then fine-tuned into a research question. Research question is what the investigator wants to know and not what the investigator might be able to do. They focus on one issue only, and they formulate the research problem into a research question. That is by translating and transforming the research problem into a scientifically answerable research question. But from where shall the researcher get the idea for a research question? There are innumerable literature reviews, which is also known as the mother of the research. It can happen anytime during your discussions among your peers. The idea can crop up at conferences, any research meetings, and the researcher can brainstorm by applying new technology to the old ones. You read it critically and summarize it. You check out their references, the sample size, the study design, and what conclusions were given in the study. There are vast areas for research, and there is a lot of data that is available that is eventually converted into a research question. Just to describe, there are two types of questions. One is descriptive questions, which involves the observations to measure quantity. There is no comparative group in this type of questions. In analytical, they have a comparative group in which you test a hypothesis. What are the steps to conceive a research question? First and foremost, the investigator reviews the information. Then they raise a question and decide whether it is worth investigating by having peer-reviewed discussions. Then you have to define your exposure and your outcomes, which will eventually sharpen the initial question. And lastly, you add the specific details and refine your research question. The investigator may ask what to be measured, which variable to be included, who will be enrolled in this study, and how the study will be conducted. To take an example for each step, we all know that exercise do help control the blood sugar levels and blood pressure. In this, first of all, the investigator reviews the information, like should diabetics do exercise daily? Then they can ask, can exercise help control blood sugar? But it is still not very specific. It is a very broad question. Then you can have peer discussions regarding what is the level of reduction of blood sugar. Now you have exposure and outcomes with you. Exposure will be exercise and outcome will be blood sugar levels. Then you can sharpen your initial questions by adding more specific details. Like among diabetics, does physical activity for 1 hour help in reducing the fasting blood sugar levels? Now we are specifically targeting the fasting blood sugar and physical activity for a time frame of 1 hour. Then you refine the question in the end, and which will become your research question. That is, in order to improve management of type 2 diabetes, we wish to know whether brisk walking by diabetics for at least 1 hour reduce fasting blood sugar levels as compared to those who do not. Every question must be subjected to a finer test, or the so what test. The components of this test are: first, you should check the feasibility of the research question, whether it has adequate subject, expertise, and whether it is affordable or not. It should be interesting to the investigator. It should have the novelty factor. Either it provides some new findings or confirms or refute the older ones. Ethical consideration of the subject must be kept into mind, as your institutional ethics committee will give you a clearance to conduct the study. And whether it is relevant or not, whether it will have any impact on the clinical practice or the scientific knowledge. You should also ask yourself, are you fascinated by the topic? Do you have the necessary research skills? Do you have the financial sources to conduct the study? And can you complete it in time available? And do you have access to data? When you have to formulate your question, PCOT comes into existence, where P stands for what type of population or patient and what is the problem, which intervention will you be using, do you have a comparator or a control group, what will be your outcome measure, and what will be your time frame of the study. After you have formulated your research question, you again check it, whether it is clearly stated, whether it is stated as a question, is it testable in the field? Have you defined the variables that you are going to study in the project? Have you defined the samples? And do you have a defined setting for your study? A good hypothesis just has 3 features. It should be simple, having one exposure and one outcome. It should be specific, that is, there is no ambiguity among the study variables. And it should be stated and focused on the primary objective. After your research problem is translated into a research question, that research question is now translated into objective. It should be framed and written in scientific and epidemiological terms. You take the question in a few limited axes, and no more than one verb for each objective shall be used. The objectives can be sorted into primary and secondary. And you have to be clear regarding the type of question. Whether it is a descriptive question where you will be measuring a quantity, or an analytical one where a hypothesis is being tested. Your objective needs to be SMART. That is, they should be specific. What precisely do you hope to achieve from undertaking the research? They should be measurable. What measures will you use to determine whether you have achieved your objectives? Are they achievable? Are the targets you have set for yourself achievable given all the possible constraints? Are they relevant? Will the outcome be of relevance to the stakeholders? And do you have the time to accomplish all of your objectives? As discussed, we have 2 types of questions. In descriptive, we estimate a quantity, and we use the verb estimate for descriptive studies. In analytical, we are testing a hypothesis, we use the verb determine. These studies will be dealt on in detail later on in another session. Now, our research problem was converted into a research question. That becomes, in order to improve management of type 2 diabetes, we wish to know whether brisk walking by diabetics for at least 1 hour reduce fasting blood sugar levels as compared to those who do not. And our primary objective is to determine the effect of brisk walking for at least 1 hour daily on fasting blood sugar levels of patients with type 2 diabetes compared to those who do not. To sum up this session, your research question should be researchable, it should be feasible, relevant to the field, clearly stated, have ethical considerations for the subject, should not be too long, should address the data, and should be limited within the research problem. Thank you for listening to this session. Thank you.